All right, so for face and head trauma, let's just do like a quick hits. So I talked to you guys the other day about Le Fort fractures. It's really easy to remember this. So Le Fort 1 is here, okay? Le Fort 1. Le Fort 2 is here. And then Le Fort 3, like a 3, is here at the base of your skull. So boom, you just figured out Le Fort fractures. 1, 2, and 3. Very easy. Now, speaking of a Le Fort 3, so this is a fracture now at the base of the skull. So what are the other physical exam findings we see in somebody with a basilar skull fracture? Well, a lot of times they have hemotympanum or even blood coming from their ear. That is a sure sign of a basilar skull fracture, a fracture at the base of the skull. What's the other common physical exam finding? You're not going to see it right away, but you'll see it maybe the next day. This here, the raccoon eye, is the battle sign. All right, so battle sign is going to be a strong indicator of a basilar skull fracture. And then the head itself, we talk about traumatic brain injuries, so we'll just do a very high level thing here. So subarachnoid hemorrhage, right? Subdural hemorrhage, intraparenchymal or cerebral contusion, okay? Those are going to be our most common. And then there's the other one, which is the epidural, okay? Those are our most common forms of brain injury. And then when you see a bunch of scattered hemorrhages throughout the brain, typically in an acceleration-deceleration injury, that's what we call DAI, or diffuse axonal injury. So those patients actually tend to do the worst because in a big subdural or big epidural, there's a lesion, there's a mass effect, there's something for us, our neurosurgical colleagues to go after and to take care of, where the real treatment is just managing their intracranial pressures. So we're gonna start these patients on like some 3%, some hyperosmolar therapy. If there's big concerns of cerebral swelling, cerebral edema, we can give mannitol. I always say mannitol is like CPR, but for the brain. We're going to put them on seizure prophylaxis here with Keppra, and we're going to reverse any antiplatelets or anticoagulation therapy that the patient's on.